Folks, Nick the nurse here. Today we're going to be talking about the nursing problem of hypercalcemia, and specifically we're going to be talking about nursing interventions that you as a nursing student should be familiar with if you want to do well on your nursing school exams and eventually on the NCLEX so that you can achieve your dream of becoming a registered nurse or licensed vocational or licensed practical nurse. So, nursing interventions for hypercalcemia include monitoring calcium levels. I want to kind of say, well, duh, that kind of goes without saying, but you'd be surprised how many nursing students actually miss that on exams. Make sure that you know that you need to assess or monitor calcium levels. Monitor the patient's intake and output. Monitor for dysrhythmias, because remember, we need calcium for our heart to beat effectively and for all the conductivity and stuff. We need potassium and calcium and sodium and phosphorus, all of these things in our body to make everything regulate correctly and move right. So we want to make sure that we monitor for dysrhythmias because calcium, hyper and hypocalcemia can cause the patient to have dysrhythmias. We also want to encourage the patient to refrain from eating foods high in calcium. Well, yeah, if you have a patient on your nursing school exam who has high calcium, probably not a good idea to give them high calcium foods. We also want to make sure that we assist the physician in preparing the patient for a parathyroidectomy as indicated, because remember, with hyperparathyroidism, which is an indication for a parathyroidectomy, hyperparathyroidism causes an increased calcium, decreased phosphorus. Again, increased calcium, decreased phosphorus, so we want to make sure that we keep that at the forefront of our mind as well. We want to advise the patient to avoid foods high in vitamin D because vitamin D and calcium go hand in hand with the absorption into the bone, so we want to make sure that that doesn't happen. Encourage fluids in the patient to flush that excess out. Monitor for fractures, because when we deal with calcium issues, you can certainly have fractures. Monitor vitals, monitor for confusion in really bad cases, administer calcitonin as prescribed, and that's one I would really pay attention to because calcitonin is used in hypercalcemia. So if you get a question on your nursing school exam that deals with calcitonin, when you see calcitonin, you should automatically think hypercalcemia. Hypercalcemia, use calcitonin to lower that calcium level in the body. We also might want to think about administering loop diuretics as ordered, encouraging ambulation, strain the urine for renal stones because those can be increased in a patient who has hypercalcemia. We might anticipate that the physician may order hemodialysis if the patient has kidney failure. So that's another thing that we need to pay attention to. Lots of good information there. I hope you've learned a little bit. I appreciate you watching. My name is Nick the Nurse, and if you'd like to check out any of my other completely free videos, they're all at www.nickthenurse.com, or you can check out my YouTube video and subscribe at Nick the Nurse. Thanks for watching. I'll see you next time.